So today we're covering integumentary system and skeletal system. So if you go to week 5, you'll see the handouts for today if you haven't printed them out already. You also have up here it says practical 2. So if you go there, it takes you to this page where you have a review sheet, study guide, a blank study guide, and a digital practice practical. If you don't feel like you did as good as you wanted to, I think Ms. Parrott will have the practice practical up for the second one next week. Also, if you haven't taken advantage of any of her tutoring, make sure you do that. So start that as soon as possible. All right, let's see. Okay, so let's look at the review sheet. Kind of gives you, at least for today, terms around the skin. All right, so here's some terms around bone. Okay, also more terms around bone that you'll learn today. All right, next week we'll go over joints and muscle. Okay. All right. So let's go through study guide. So this picture of skin, let me see if I can switch it. All right, so your skin, it's part of your integumentary system. So this upper layer, the epidermis, or more superficial layer. Deep to that, you have the dermis, larger layer. And deep to the dermis, you have the hypodermis. All right. So in the epidermis, you have the surface of the skin. Here you have a hair shaft. Okay. So that hair shaft's projecting from the dermis, where you have a hair follicle. Okay. So connected to that hair follicle in the dermis, you have an erector pili muscle. Okay, and its role is to help those hairs of those muscles stand up straight. So when it contracts, it pulls on the muscle, and it pulls on the hair follicle, and the hair moves. Okay, you also have sebaceous or oil glands here. You also have sweat glands in the dermis. Okay, here's a duct movement, so that sweat can go out through a pore to the surface of the skin. All right, you've also got receptors, the connection to your nervous system. All right, and in your hypodermis, you've got blood vessels and adipose cells. Okay, you do have some blood vessels in the dermis as well, going into the dermal papillae. No blood vessels in the epidermis, avascular. Okay. So the bottom 2 lines, they're pointing to nerves and the receptors. So this is a nerve, and this is a receptor. Okay. All right, so I'm going to give you a minute to look at your models that are at your table, see if you can locate the structures that you see on the slide. Okay, so let's move on to the lunula and structure of the nail. So on the nail, most of what you see on your nail is your nail body of your nail. The white moon-like structure you see there, that's your lunula. So it's like a moon, lunar, lunula. And this skin, the fold of skin there, that connects where the lunula touches the rest of your nail, and the skin in the rest of your nail is called a cuticle. All right, so you can see that from both angles here. So you can see the cuticle there connecting the body of your nail to this surface of your nail or of your finger, right? And you can also see the body of the nail here. Okay, from this angle, you don't really see the lunula. Okay. But those are structures in your nail that you need to know. Okay, another point about your nails you need to know is the difference between thick skin and thin skin. So you will see probably on a practical some question asks you to identify a slide, and you'll have to say, is this thick skin or thin skin? You see lots of layers, it's probably thick skin. You don't see very many layers, probably thin skin. Another way you can tell is where you find it. Thick skin, you see them in the palms of your hands, the soles of your feet. Okay, everything else, all your other skin is thin skin. Okay, but hopefully you can tell there's a lot more layers over here than here. Okay, so thick skin, thin skin. Okay, so that's what you need to know about the integumentary system. Let's go on to the skeletal system. All right, so here what I want you to know is the inside of your bone is made up of a structure that we call spongy bone. So it looks spongy if you have to be a little creative, but basically the outside of your bone is really hard. It's compact bone. Inside, spongy. Also, you'll see inside your bone these rings. So that collection of rings and that area in the middle called the central canal, which has blood vessels in it, is called an osteon, also known as a aversion system. They mean the same thing. Now, each individual ring is called a lamella. A collection of rings or multiple rings called lamellae. But if you add the central canal with the blood vessels, you get an osteon. Okay, so those are just terms you want to know about your bones. Looking at your bone from a different angle, you can see these areas that we call the epiphysis and the diaphysis. On the edges of your bone, or the ends of your bone, you have what we call an epiphysis. You have one at either end. So you have one on this end, you have one on that end. Okay, both called epiphysis. Plural is epiphyses. Inside the epiphysis, you have your spongy bone. Okay, that we just talked about. You also see it on the edge of the diaphysis. Now, in the shaft of the bone or the diaphysis, you have your compact bone on the outside, which is lined by periosteum. Okay, peri, we'll see that as an outer lining. So osteum means bone. So it's the outer lining of the bone. So, and on the inside of that diaphysis, instead of spongy bone, we have what we call a medullary cavity. And it's lined by something we call endosteum, which has to do with blood vessels. It's a lining for blood vessels. Well, and why do you have blood vessels in the inside of your bones? Because you need blood for your bones to grow, right? You need blood to produce bone marrow, okay, for immunity. Okay, so that's why you have blood flow to that area. Okay. So if y'all look up here, everybody look up front, this is the cow bone. So you can see on the outside, compact bone, right? Hard. Look on the inside, here's your spongy bone. Okay, a little bit of spongy bone here on part of the diaphysis, but now we're getting into the diaphysis. Here's your medullary cavity. Okay, all right. Here's a smaller version. Okay, compact bone. Okay, lined by periosteum. Okay, here's your spongy bone. On the inside, here's your medullary cavity in the diaphysis. Okay. All right. Let's talk about the skeleton. You can separate the skeleton into two main sections. First, we're going to cover the axial skeleton. And axial skeleton is basically the core, the base of your body. Okay? You have your skull, which is made up of your cranium at the top and the facial bones at the bottom of your skull. You have your vertebral column, okay, contains your vertebrae, your thoracic cage, which contains your sternum and your ribs. At the base of your vertebral column, you also have the sacrum. Okay, that's your axial skeleton. All right. So everybody, take a minute, look at the skeleton at your table. Locate the skull, thoracic cage, and the vertebral column. Okay. Okay, so let's go on to the appendicular skeleton. So the appendicular skeleton, appendicular is a big word. It just means appendage, which basically means your upper limb and your lower limb. So in anatomy, we don't say arm, we don't say leg. We say upper limb, lower limb. Okay? All right, we also include in our appendicular skeleton the pelvic girdle and the essentially pectoral girdle. Okay? So here we've got the clavicle and the scapula. So in anatomy, we don't say collarbone, we say clavicle. We don't say shoulder blade, we say scapula. So again, when you all go on to your respective health programs, those words we can't have in our vocabulary anymore, okay? You are health science students, okay? So you can't use those words. All right, and I don't want to hear that my students are using those words because I taught you to use the correct anatomical terms. All right, so again, clavicle, scapula. All right, you've got your humerus, radius, and the ulna. So if you're in an anatomical position, hands out, palms facing out, the radius is on the same side as your thumb, okay? The other bone in your forearm would be your ulna. Okay, your wrist has bones in it called carpals. Okay, now this next set of bones, that's the base of your hand. Okay, those aren't fingers yet. It's the base of your hand. Those are your metacarpals. Okay, now your fingers are phalanges. Okay, so your hands, your fingers are not this long. This part here, that's your base of your hand. Okay. All right, and your lower limb, this large bone is your femur. Okay, this is your patella. It's not a kneecap, it's a patella. Okay, so again, we don't use those terms. Okay, all right, this large bone in your shin, this is the tibia. If you are creative, you look at it, goes up and then kind of goes out. Looks kind of like a T. So that's their tibia. The thinner bone is the fibula. Hopefully you remember the fibular area or body landmark or body region. So just like your wrist bones are called carpals, your ankle bones are called tarsals. The base of your foot, the bones in the base of your foot are called metatarsals. And your toes are phalanges as well. Okay, fingers and toes are phalanges. Okay? All right, so I'll give you a minute. Look at the bones of the appendicular skeleton on your skeletons. You also have some bones in the boxes at your tables. All right, let's look at the skull. So you may think of the skull as one big piece of bone, but it's actually made up of several bones. So the front area of basically your forehead, that's your frontal bone. Okay. All right, should make sense. The frontal area. Okay, the back of your head, black bottom, that's occipital bone. All right, I think that was one of the landmarks that we studied, the occipital area. A more top back part of your skull is your parietal bones. Side of your skull, where your temples, as people say, and your eardrum, it's temporal bone. Your cheek is made up mostly of your zygomatic bone. Okay, your upper jaw is your maxilla, lower jaw is your mandible. Okay, this bone here, it's a little harder to see from this angle, but you'll see it from another angle once we look at another view. It's the sphenoid bone. All right, this little bone here, if you imagine if this skull were crying, the tears would just drop right there. That's the lacrimal bone. We call it there because the lacrimal ducts are also there, and the lacrimal ducts are your tear ducts. And just behind it, or posterior to it, is the ethmoid bone. And this bone here at your nose is nasal bone, right? Nasal region. Okay. So give you a minute. Look at those. Try to find your bones in the skull. You got skulls at your table as well. All right. Let's look for a different view. Here you can see some sutures. All right, so you have the sutures. Sutures are basically like, when you think of sutures in surgery, it's like sewing something back together, right? But in this context, it's how the bones fuse together. So basically fusing the parietal bones together is a sagittal suture. Why do you think we call it sagittal suture? It's down the middle, right? Right? Cutting into right and left sides. So sagittal suture, right? You also have here a coronal suture, okay? So another word for coronal in planes is frontal, right? So it's frontal plane. So front and back half. So this is a coronal suture. Okay, another way of thinking about it is this is where, if this were a king, this is where the crown would sit, or the queen where the crown would sit. So coronal suture. All right, where the parietal bone and the occipital bone fuse is lambdoid suture. Where the parietal bone and the temporal bone fuse is the squamous suture. So this area right here, external acoustic meatus. So when you think of acoustic, you might think of guitars or music that doesn't require any electronics. All right, think about sound. This is where sound enters into your eardrum, okay? Also, hole. There's a hole here in your chin. Another word for in anatomy, we don't say hole. We say, well, one of the words we use for hole, and we have different words for holes, but one of the words we use is foramen. And because the chin area is the mental area, it's the mental foramen. Okay. All right. Another view. You're asking what? Or there? This one?
Yeah.
I'll get to these down here. Yeah, it's Occipital Bone and Foramen Magnum. So let's see. There we go. All right. So here's another view of the upper jaw, maxilla bone. And here's a new bone that we haven't really been able to see yet. It's a Palatine Bone. Okay. So if you watch a lot of cooking shows, Gordon Ramsay, all those different shows, they talk about the palate, right? Being able to taste certain things. All right. So here's the Palatine Bone. Okay. So maybe it helps you remember that one. All right. You have the zygomatic bone at the cheek here, right? All of this in orange, this is the temporal bone. And obviously our skulls aren't these colors, it's just we're using the colors to help you see the areas. All right. The pink area is another view of the sphenoid bone. Now you have to be creative, but in my mind, when I look at the sphenoid bone from this angle, I see elephant ears. Okay. So if you don't see them, don't worry about it, but that helps me to sort of visualize where it is and to identify that bone, right? Because sometimes it can be difficult to figure out, what is that? They're like, oh yeah, that's the elephant ears, that's the sphenoid bone. All right, all of this in the back of the head and kind of the posterior part of the head is the occipital bone. It's a large hole here. Okay, remember we said holes are foramen. So, because it's such a large hole, we call it the foramen magnum. What do you think goes through the foramen magnum? Your spinal cord. Very good. All right, and here's just a small view of your parietal bone. So if you've got a skull at your table, you can turn it over and see if you can see any of these bones. Okay, let's talk a little bit about the vertebral column. So if you start from the most superior, you've got the cervical vertebrae. There's 7 of them, C1 through C7. C1 is known as the atlas. C2 is known as the axis. They each have a very unique shape. The rest of the cervical vertebrae have kind of a flattened shape. So the cervical vertebrae kind of have this shape, kind of like that. Okay. Your thoracic vertebrae, you have 12 of them. Okay, and they're called that because they support the thoracic part of your body. Okay, in between your vertebrae, you have what we call intervertebral discs. So if you ever heard of anybody slipping their disc or having a herniated disc, that means those get damaged. Okay, very painful, right? Because they're meant to support the weight of your body, and when they don't, it can pinch nerves. Okay, so thoracic vertebrae. So they've got sort of a more of a shape like they have wings that sort of fly out. Okay, so that's more of what a thoracic vertebrae is going to look like, whereas a lumbar vertebrae will still have kind of the structure at the top, but its wings, so to speak, are more 90-degree angle. Okay. And these holes are basically where your spinal cord goes through. Okay. So again, there's 5 vertebrae in the lumbar region, and below that you've got your sacrum and your coccyx. Okay, so I'll show you that there. Now, what I'm most concerned about is that you be able to tell me generally what's a cervical vertebra, what's a thoracic vertebra, what's a lumbar vertebra. Now, I could get real specific and say, know this part of each one of those. What I'm most focused is, does it look like this, does it look like this, or does it look like that? Does it have more of a kind of a round-ish or ovalish shape? Does it have wings that kind of go out at 45-degree angles, or does it have wings that go at 90-degree angles? Okay, that's what I want you to know. Okay, because I know there's some additional slides that you have in your print notes that talk about the shapes, so I just wanted you to see that. And in your boxes, you should have some vertebrae in there as well that you can look at. All right, thoracic cage. Okay, so this structure here on the skeleton looks like a tie, necktie. This is a sternum. Okay, these are the ribs, right? So you have 3 categories of ribs. You have true ribs. The first 7 are considered true because they attach directly to the sternum via this cartilage. The false ribs, which is ribs 8 through 10, okay, these are considered false because they essentially have to attach to the 7th rib in order to touch the sternum. Okay. And you have floating ribs, these 2 down here, 11 and 12, and they don't have cartilage. They don't attach at all. So they're floating. So true, false, or floating. Okay, so you can look at the skeletons at your table, and you should be able to see the first 7 and identify them as true. The next 3, identify them as floating because they don't attach directly. They attach to the 7th vertebrae, or 7th rib rather. And then you have your 2 floating ribs that don't touch at all. Okay. So I'll give you a minute to look at that.